Good evening and welcome to the Wednesday evening webinar. I am most grateful to Professor Khalid Masood Gondal, Vice Chancellor of the King Edward University Hospital in Lahore. The King Edward Hospital has connections with Ireland. It was first recognised by Dublin University or Trinity College. And also one of its teaching hospitals is Mayo Hospital after the Earl of Mayo. And not the Mayo brothers from Rochester, Minnesota. We have a presentation from Professor Bilquis Shabir, who is chairperson of the telemedicine project that has been undertaken in the King Edward University Hospital.
I'm very grateful to the President, Royal College of Surgeons of Ireland, Professor Khalid Masood Gondal, and Professor Brar for giving me this opportunity to talk on this forum. King Edward Medical University being the oldest institute in the subcontinent of carrying a history of more than 160 years. The Department of Telemedicine services, if you could move on to the next slide, telemedicine services were offered and initiated by the Governor of Punjab, next please, who is also the Chancellor of King Edward Medical University and all the medical universities of Punjab. It was the 12th of March that he decided that since the first wave of COVID is coming up, why not, and the OPDs are closed, why not come up with telemedicine, which he had seen during his 36 years of stay in the UK. That was when he called all the vice chancellors of various medical universities, King Edward Medical University being one of them, and that was when this telemedicine department came into being and it was inaugurated. You can see in the picture on the 19th of March, 2020. Next. And at that time, next please, at that time, the plan of the Chancellor was to offer corona services. But it was the vision of my teacher and my mentor, our Vice Chancellor, Professor Khalid Masood Gondal, that if he could offer tele-corona services, why not tele-OPD, which were being closed at that time, as Dr. Shameen Qureshi has mentioned, due to the overload of patients and the fear of infectivity across the patients as well as the medical staff. So we started off with telemedicine, telesurgery, telegynecology, telepediatrics, telepulmonology, telecardiology, teledermatology, telenutrition, and last but not the least, telepsychiatry. Next, please. And then as problems came up, we came up with tele-vaccination, telenutrition, and also, inshallah, at the end of this month, we are coming up with a tele-obesity clinic as well. These are the numbers which we shared on the various websites and various links and Facebook page of King Edward Medical University. And here you can see that every counter has three modalities of communication. One is landline for very poor, underprivileged people because we are a poor country. Then WhatsApp and mobile services, and then Skype. So these are three modalities on every counter that were offered to the people of not only Pakistan, but also from across various, across the globe. Next slide, please. I'll show you the statistics, if you can move on to the next slide, of what telemedicine has been able to offer. Yes, you can see this blue, almost it is 48%. This is the Department of Medicine, which has been offering tele-corona and telemedical services, and the rest are the various other departments which I just mentioned. Next, please. You will see in the next slide that we came across calls. Next slide, please. Chanel, next slide is very important. We came across calls from more than 75 regions of the country. And only in the beginning of this month, we marked 10,000 calls. And out of those 10,000 calls, when we analyzed them, Only 4,000 were from Lahore, and the rest were from about 5,000 from other regions of the country. And in this slide, where you can see the red bars, you can see we were receiving foreign calls as well. And you would be very interested in knowing that majority of the calls are from the Middle East. You can see Saudi Arabia, Dubai, UAE, Kuwait, Oman, Muscat. These are the areas where our local expats are staying, and they have, they are poor people who are working there as laborers. This service was offered absolutely free of charge. And they were very comfortable with Urdu and Punjabi, the local language. So they were the ones who were calling us. And it's a very interesting thing that we've also received a few calls from UK. And today we received a call from Greece as well. Next. So this generally, the next slide will tell you that generally people will, because we always get feedback from the doctor attending to the patient and the patient. So the mutual feedback form, and you will be interested in knowing that majority, about 98% were satisfied with the knowledge imparted to them. Next, please. This is just without, breaking the confidentiality of the patients. It's just what we were able to, within the limited resources, we were able to exchange with the patient. You can see on the left side is a report of a PCR being detected in a patient. They were able to exchange radiographs, and you can see the chest X-ray with the HRCT. Next slide would tell you, they would share with us the temperature. Next slide, Chanel. The temperature, the oxygen saturation, if you could have that, yeah, the oxygen saturation. Look at this patient, his saturation fell to 83, which, marked the point when he should have reported immediately to the nearby health facility, which we advised, and he was able to, and we are very happy that he survived. Besides corona, we were also having other specialties. You can see there's an orthopedics, hallucis valgus on one side. Next slide, please. There were some dermatological cases. You can see in the next slide, if Chanel, we can have it. There is, Chanel, if we can move to the next slide. Yes, in the previous slide, if you could have it, we have some dermatological condition. Yeah, this is a very interesting case where he shared this because it is associated with thrombosis. This was a COVID patient who had digital ischemia. On the left side, this picture shows you. Then there was this tinea, and then there were this ecchymosis. This was about of an admitted patient. Next. The next slide is very important because with telemedicine, we were able to communicate. Next, please, Chanel. We were able to communicate with the affiliated hospitals and the consultants of Mayo Hospital and King Edward Medical University, previous one, please, were able to share their expertise with the ICUs of the affiliated hospital. So this picture was from Port Haja Said Hospital of a remitted patient, and you can see how we were able to offer them advice regarding the care of that specific patient, and he was ventilated at that time and he was extubated. Next, please. And then we were able to share various modalities of treatment. Just sticking on to COVID, this is the chart we would exchange at our nutrition center. And this is the spirometry device, which we would explain on the Skype and the WhatsApp video how to use. Next, please. Then the various important positions, which have it's evidence-based that these positions improve the mortality and morbidity rates of COVID patients. So this was easily explained to them by charts. Next, please. The next chart is in Urdu. I'm sorry for that, but this is the national language. This is about the vaccination schedule. So when we were having the vaccination weeks, there were 2 weeks which were during the last month. 2 weeks were dedicated to vaccination of young children. And this is with this chart we shared with every patient, whatever the problem they came up with in the tele OPD, we shared with them so that any child belonging to any of the family could make use of this. Next, please. And talking about the training and supervision, this technology is definitely not a panacea to the problems of the clinical training of students, definitely. Nor does it generate knowledge per se. But in the current pandemic situation, it definitely allowed the medical universities to continue on to the practical learning and ensure that the students under training achieve part of the skills, at least remotely. Next slide would be this very interesting slide. Next, please. You would see, next slide, Chanel. You would see there's a patient this was a call received from UAE of a patient at the orthopedic counter where he was, you can see the external fixators, and our own Vice Chancellor, Professor Khalid Masood Gondal, who himself is a surgeon with special interest in orthopedics, is directly counseling the patient as to the further care of the patient. That patient was stranded in UAE because of the travel reservations. Next. You can see the picture above is that of Professor Saira also. She is Dean of Preventive Medicine, and she has played a very pivotal role in the department of telemedicine and the preventive part of it. And you can see she's training her trainees as to how to deliver services at telemedicine on Zoom. You can see there's a discussion going on between myself and Professor Khalid Masood Gondal, and the pulmonology resident is standing with us and he's presenting the case to us. The picture lower down shows Professor of Dermatology, Professor Ijaz. The case being discussed is being presented by a trainee of dermatology, and it was managed and advised according to protocol. Next slide would show you similar pictures. It's a busy slide, but you can see we are also very busy here. The first slide shows Professor Sajid Ubaidullah, Professor of Medicine, imparting advice to his trainee. The slide in the center shows myself, my associate professor, my senior registrar. That was a busy day. We had about 80 calls that day, and all of us were busy on the phone. And similarly, the slide in the right lower left shows how the trainee is being guided by the specialist as how to advise the patient. Similarly, the next slide shows senior consultants training their residents. Could you move on to the next slide, Chanel? Yeah. These are also senior consultants, Professor Adil, Professor Somia, Professor Bilal, Professor Saira, all of them imparting knowledge to their trainees. Next. Now, this is a very interesting slide. What we further improvised upon was the critical patients. Every night you can see Professor Khalid Masood Gondal on every screenshot. These are 3 screenshots. These have been taken with permission from the patients. The cases were individually discussed. Medical boards were constituted. So for example, in the middle slide, you can see Professor of Pulmonology here, Professor Khalid Masood Gondal, myself, Assistant Professor of Pulmonology, and the patients whom we are dealing with. And they were guided on WhatsApp on daily basis and monitored, closely monitored. So this was something, a further step ahead, which was a pure innovation of Professor Khalid Masood Gondal. And this went on, especially during the, when the crisis hit its peak, especially during the last month. Next, please. This is a very important, the next slide, Chanel, is a very important department we must talk about. Chanel, can we move to the next slide? Yeah. The tall professor you see is Professor Ali Madi Hashmi and Professor Aftab and Professor Nazir Shimran. All of them are professors of psychiatry, and psychiatry was something which was definitely indicated for the patients, for the families, and you can see psychological first aid. This was given during multiple sessions with the doctors and the nurses and the paramedical staff who were dealing with the patients, because all of us went into stress, especially during the first wave. So telepsychiatry was a very, very pivotal part of is a pivotal part of services. And this again is an innovation of Professor Khalid Masood Gondal. Next, please. We had health training sessions. The next slide would show you it's a flyer, which is about a telemedicine webinar, which was held in January. The next slide would show you another telemedicine webinar, which was held in April. And you can see the speakers, and we discussed, and we learned a lot. And COVID has been kind in a way that it helped us learn a lot. And telemedicine and tele-education was one of them. Next, please. You can see the happy faces. Next slide is a very interesting slide. You can see the happy faces when Professor Khalid Masood Gondal was talking to the residents and taking their feedback as to how they feel about telemedicine and education on telemedicine. And you can see the smile of the faces. And you would be interested in knowing this was on the Eid day. Next, please. We received a lot of acknowledgement and a lot of appreciation next from our teachers. The next slide will show you the visits from our ex-principals. I think the oldest graduate of King Edward Medical College previously, may Allah grant him health, Professor Khaja Sadek, Professor Mahmood Ali Malik, Professor Mahmood Ayaz also came to visit us. Next slide will show you the government officials. The next one, which include the health minister, the governor of Punjab, whose brainchild it was, and the other important dignitaries. The next slide would show you visits from the armed forces, which helped us a lot as well. So we received a lot of acknowledgement and support. And whenever there's a time of difficulty, the morals have to be high. And I think these were the people who kept us up, in all these difficult times. Next. Throughout all our 7 attached hospitals received very strong support from the government, from the governor of Punjab, from the president, and at the same time, next, we held, as Professor Fawad Mustafa talked about ongoing online classes and webinars. Next, we held a lot of international webinars. And with UK, we had weekly, and especially during the initial days of COVID, we had weekly webinars on case presentations of COVID, and we learned a lot from each other. This is a joint mission with China, BRIMEA, that is Belt Road International Medical Education Alliance. Next. This is how, because it started off from Wuhan, the Chinese came over here and they actually, taught us how they came out of it. And this is another webinar where our Vice Chancellor was the chief guest. The next slide would show us another picture of a webinar. It was a webinar from various people from UK, from USA, from Canada, from Australia. The health minister and the minister of education were the chief guests, and we learned a lot during the initial days of COVID. Next, during these webinars. And then there were online classes, and we held post-emergency reviews and mortality, morbidity reviews, case presentation, journal clubs. As Dr. Fawad Musa said, we also continued as per the requirement of College of Physicians and Surgeons of Pakistan. We continued these at King Edward Medical University. With this, the vision continues. The way forward next would be this is the vision of a Vice Chancellor, to have have a department of telemedicine on permanent basis, to have a department of infectious disease on a permanent basis, which we still lack in our country. Next. So everything is teamwork, and this is what my mentor and my teacher, Professor Khala Masood Gondal, always tells us. And the last slide tells you all, the next one, who were the people behind all this. The governor of Punjab, you can see in the right first slide, it was his initiative. And you can see Professor Khalid Masood Gondal, who received the Presidential Pride of Performance Award for his services of COVID. He's receiving the reward directly from the President of Pakistan in this picture. Thank you so much for patiently listening.
Well, can I thank our colleague for really putting an enormous effort into these presentations. Clearly, there's been great effort in teaching and extending telemedicine during the COVID pandemic, and you are really to be congratulated in what you have achieved. I am very cognizant that you put together this presentation over the weekend following the festival of Eid, and so we are grateful to you for making this particular effort. Thank you.